Hi everyone, it's Autumn. So today I wanted to tackle something that I've been wanting to talk about for a while and go into in more detail, which is codependency. Now I want to preface this with saying a few things. These are kind of my general notes and main issues that I'm going to try to make more brief that I'm using in an article I'm writing for my blog. So I'll post that once it's done. Now, I'm not going to go into too great of detail as I will in the article because I'm going to try and make this not a very long video, although it may be a little long. But I want to give enough information and details to kind of support some of the arguments I'm making. Now, I feel like I have to preface this by saying that all of this because I don't want to offend anybody that has attached to codependency, where they have. I noticed that people in this particular issue, codependency, that because of the type of people that are labeled as codependent, and you'll see what I mean later, but usually they're very empathic, they're very sensitive, they're very kind people. They tend to take codependency. I have found, not everyone, but some people, and use it as something that they use as their identity. It's very common. So I want to just say that because I don't want to offend anybody that has taken this and then I feel like I'm blowing up their whole identity. I'm not. And it's not negative. And remember that even if you've taken on any label, it's a label someone else has put on you, a label your parents put on you, your coworkers put on you, other people put on you, a therapist put on you, even a label you put on yourself. Remember, that's just a label. That's not you. And it's okay to later see different information and to decide, you know what, this label doesn't fit me at all. It never did, or it doesn't fit me anymore. So this video is about codependency and what I see as detrimental gaps within this modern idea of codependency, and how it really does encourage people to look at themselves as disordered, when really I have found in my personal experience and talking to other therapists and doing a lot of research and being in the mental health field, that many are not disordered, that are labeled as codependents. This video I want to talk about how it is too general of a term and a label, and therefore it has become almost meaningless in terms of recovery or healing one's life, to have the life that that person really wants. How we live in a society that is too focused on the self, and really codependency has become a microcosm of that ideal. It has become a representation of our narcissistically driven, self-based society and concept that is currently held as good or right in our society. I'm going to be talking about how I believe codependency is too generic and actually prevents the true healing or recovery to take place, how it is often used as a catch-all condition that I've seen over and over, that gives therapists and clinicians an easy way out by labeling a patient as codependent instead of looking and trying to find the underlying specific cause of a particular trait, which is way more difficult. Real issues that a person actually has, that if they were to be looked at outside of the lens of codependency, I think greater healing would happen. Things like PTSD, complex PTSD, borderline personality disorder, specific attachment issues, self-esteem issues, etc., that are often, like I said, mislabeled as this generic catch-all codependency. In this video, I will discuss several arguments as to why I believe the current concept of codependency needs to be completely abandoned and reworked into anywhere from 4 to 6 ish more specific issues to properly address clients' needs or their real needs. And that and like I said before, that many people with codependency only have situational codependency. Instead of looking at it from a or okay, instead of looking at it how we currently do, that it needs to be tackled from a more of a coaching perspective, or implemented in more of a coaching way. And what I mean by that is to look at the whole of a person's life to see exactly what situations these quote unquote codependent traits are coming out in, and to restructure one's life. That these people that are labeled as codependent, I have seen the vast majority are not disordered. They don't have real issues. They have situations in their life that need to be changed, and they need someone to coach them through making those changes. So keep in mind, though, I am by no means saying that the traits that codependents have aren't real. For some people, and I believe it's a very small minority, they are very real and they need to be remedied in very clinical and or psychodynamic ways. But also keep in mind that many people labeled with codependency don't actually have a real issue or disorder, and that I'm not giving a pass to people who, let's say, give too much to people who don't give back and therefore hurt themselves. I'm not giving a free pass on people who are playing out childhood dynamics to garner love and attention in unhealthy or self-destructive ways. And I'm not giving a free pass to anyone that's doing any of the fundamental codependent traits that may be, if they are, adversely affecting their life. These things should be addressed, but I believe, as I said before, the vast majority of people who've been labeled as codependents aren't truly disordered, nor do they have real problems or disorders or dysfunctions that simply need to be looked at outside of the lens of codependency, which, again, codependency as a generic label, and that the issue at hand should be examined more specifically. Okay, that said, let me start with a couple of my points. Okay, so codependency is not listed in the DSM, Diagnostics Manual, because it is not a personality disorder, nor is it a mental illness. And while it is my opinion that codependency does not truly exist in the way that is commonly propagated in mainstream psychology and in the media in our current society, but for the sake of this first point of contention, let's for a moment just look at codependency through this mainstream lens and say that yes, it exists at the current popular belief and ideology that we all know it to be. And let's, examine it from that level. Okay, so right now I'm just saying, yes, it exists exactly how they say it exists. Okay. Well, there's a huge issue within this commonly held concept of codependency, and that it is so general, and I kind of said this before, that it is so vague that it can actually be applied to a large majority of the human population, and virtually all of the pet and dog cat population. I mean, I really believe that. Like, animals, our pets are incredibly codependent. That's another issue, but I kind of say that as a joke. This overgeneralization, or overgeneralized rather, set of attributes and traits and or symptoms renders the definition of what makes someone codependent often almost useless, because someone is determined to be codependent based on a set of guidelines that are so broad that if applied to the correct area of almost any person's life, or bent in a particular way, it can be applied to nearly anyone, even those with self-absorbed, selfish-based disorders such as narcissistic personality disorder. Let's use someone who has NPD, narcissistic personality disorder, as an example. Well, many of the, commonly held traits are in direct opposition of narcissistic traits. The reality is that some or many narcissists depend on the people around them to think that they're great and give them validation and adoration, and to help them validate their own feelings of grandiosity. They are often focused on pleasing that target person that they are trying to look for narcissistic supply from. So if you look at a narcissist in the idealization phase, going back to what I said previously, meaning if you bend it or just look at it in a particular area of someone's life or a particular phase in their life, Even a narcissist can be looked at as codependent, because when they are in a particular phase or period, or if you bend it to a particular, to only be in a particular way, a narcissist in their idealization phase is incredibly codependent based on the commonly held idea of codependency. Okay, so, anything that is within the realm of that is innate to the human condition, in which it's a set of behaviors, traits, or way of thinking, is applicable to the vast majority of humans, is a matter of philosophy, not psychology. So what I mean is that any attribute that is innate, that is core to being human, that is needed within the context of relationships and to live, it can be bent into a more of a philosophy, not psychology per se. And this is one of the reasons I believe that codependency, some of the core issues or core ideologies of it, are more philosophical than they are psychological. Meaning, we have these things like giving, being giving. I'm going to go into it more later so you understand it better, but giving to others is necessary. It's an innate human trait for the majority of human beings. Those that have empathy and conscience, which is the majority. And it's biological and it's evolutionary. We've evolved as social creatures. We rely on other people to survive from the very day that we're born until the day we die. And this is innate, and anything that's innate to being human, it means how much on the spectrum are you doing something? And that becomes a philosophical kind of idea, if you will. And I believe the core of codependency comes from a fundamental concept of attachment to other people. Therefore, giving isn't the real issue usually. Over giving to people isn't the real issue. The real issue is attachment. So therefore, the common modern way that we're looking at codependency is actually doing a disservice to the recovery and healing, how effective it is going to be for most people. Okay, having said that, I also want to say that I feel what is most rational, logical argument as to why codependency is a syndrome, disorder, personality issue, relationship issue, or emotional issue should not be viewed as a problem to be solved within a person. First, let's establish one thing. It's a widely held belief by nearly everyone in the mental health field and in mainstream psychology, including very traditional mainstream clinical clinicians and therapists and psychologists, as well as, let's say, like academic types and researchers, that that within the very, very wide majority of like coaches, therapists, so on, that when it comes to nearly all personality-based traits or all behavior/thinking patterns, that it is based on a spectrum, and that if we all might exhibit traits associated with all different types of mental illnesses or personality disorders or dysfunctional or disordered behaviors or thinking at some point in our lives, to some degree or another, we all will have certain traits, but that doesn't make us, that condition. So we may have certain selfish traits in certain areas of our life, but because it's on a spectrum, we don't have narcissistic personality disorder, right? So this is partly how we determine if someone has a disorder. We put their traits and attributes and symptoms, depending on what you're talking about, on a spectrum, and we determine on what level of that spectrum does it exist. But, the official criteria also by which our all behavior traits or symptoms is measured and based on, foremost, before that, is the basis of diagnosis, and is the foundational determining factor as to whether someone's traits, behaviors, or symptoms is indicative of a actual issue like bipolar or depression or narcissistic personality disorder, is where the set of symptoms or traits or attributes are pervasive in the patient's or client's lives, And are most importantly, are they causing problems in that person's life, right? So we look at, you know, is this, okay, we're looking at a patient, we're saying, okay, you have this one particular symptom. Now, it's only a symptom of a larger issue if, number one, on that spectrum, the clinician determines where it's based and if it's based higher on the spectrum, okay? And most importantly, are those traits, symptoms, or attributes, or are they actually affecting your life negatively? If you look at how mental health diagnosis is looked at, this is a very core part of most diagnoses. And that, it's pervasive, meaning that these symptoms, traits, or attributes are seen across all areas of the person's lives. Or are those specific traits or symptoms that the therapist, doctor, coach are looking at, are they only present in particular aspects of the client's patient's lives? For example, only with certain people, or only in a particular environment, situation, or in a specific isolated area or period in their life where the symptoms or traits or behaviors may have been caused by something external in the environment or by a specific person, and is more of a reaction to a particular very specific situation or relationship or life trauma or life experience in that person's life, right? So when we're looking at the actual diagnosis, so let's bring this back to codependency for a minute. When we're looking at those traits, attributes of a codependent, what is most, supposed to be most important in diagnostics is this pervasive? Is it seen throughout their whole life? Or is it situational and figuring out what is aggravating or triggering it? And if that specific trait or behavior is not seen in a person other than in one very specific part of their life, then a diagnosis based on that symptom or trait can't be considered valid. It just can't, because you can't say, you act, let's just use that word, I hate using it like a verb, but you act codependent with this one particular person, but you never do with anyone else. You can't possibly label that person codependent then. But that's very often what I see happening. So to sum that up, just kind of, this is a background, into what I'm going to talk about next. There should not be given a diagnosis based on what I just was talking about, meaning you should not diagnose a person with a disorder, a personality disorder, a mental illness, emotional issue, attachment issue, or otherwise, labeled dysfunctional labeled issue that is a collection of behaviors, traits, or symptoms, like such as bipolar, which is a mental illness, narcissistic or borderline personality disorder, which is a personality disorder, or emotional attachment, interpersonal relationship, inner self distortion, whatever you want to call, cognitive disorder, such as codependency, let's say, or a profound anger issue, where the symptoms that you're seeing in any one of those is seen only in very specific parts of someone's lives or situational. You can't just go ahead and label that person. You shouldn't. Although I see a lot of clinicians, like I said, do that. And then I want to talk about the fact that codependency, and there's quite a few different disorders that are not part of the DSM, like I mentioned before. So when you're looking at things like anger issues, there's no actual label to put on there from the diagnostics manual. I think this should be a big clue that codependency is not a part of the diagnostics manual. Look, the manual isn't perfection. I take a lot of issues with it, but just the fact, when we live in we have a very label happy society and health field and mental health field, when they are not including that label in their diagnostics manual, that should be one big, issue that people should look at and say, why is that? Why aren't they including that? So, the main criteria for looking at someone's behavior, symptoms, or traits and seeing if it's pathological or clinical and should be labeled is based on these two basic things I just spoke about. To recap: number one, see if the behavior in question and or feelings, symptoms are pervasive in that person's life. And number two, most importantly, in terms of treatment and thus diagnostics, is if the behaviors, traits, feelings, and or symptoms is impacting one's life in extreme or negative ways. It is this last point that I want to focus on when it comes to codependency. I have a question. So, when it comes to any of us giving to others too much, being too caring, putting others before us, at what point does it go from good, healthy, to bad, unhealthy? And why does it hurt so much to give to other people? Why are there all these people that are being labeled as codependent, feel this pain and this negative impact on their life when they're giving, quote unquote, too much? And here's the very simple answer for everybody. When it hurts for one primary reason, because we aren't getting anything in return. That's it. If we were giving, and we were getting back, maybe in different ways, and often maybe not even ways that are meet all of our core needs, but we essentially are getting back what we give, we don't feel hurt by it. This is to everybody. Now, again, I preface this again. I'm not saying that there aren't childhood issues that are being played out by some codependents, but I believe in the vast majority, when we look at the moment, outside of the psychodynamic framework, this is what we're seeing with codependency. People that give too much, sacrifice too much, are accommodating their lives too much to others. The reason it hurts and is so negatively impactful on that person's lives, it's because we're not getting in return. If we get in return, it doesn't even become an issue, right? So the act of giving is positive as long as you're getting back. Natural flow. And one of the reasons why I believe why, and I'm going to talk about this a little later, we're seeing codependency, quote unquote, on the rise, is because we live in a society that is so self-focused that the givers of the world aren't usually getting back. So now it's become an issue where before it wasn't. If you're getting back, it's not as much of an issue. It doesn't become a negative impact in your life. Therefore, that fundamental criteria that's used for diagnostics is not even there. And even within that context of the modern definition and concept of codependency, it is a clear part that giving undiscriminatorily in order to receive something back when we don't get it is an issue. A deficit within one's own self-esteem or self-perception. And it has been the lack of receiving in return, i.e. giving too much to people who don't deserve it because they are selfish and will exploit it, and people like addicts, narcissistic personality disorder people, so on. Okay, so if we were to give freely and get in return a comparable amount back from the people we give to, would the negative impact on our lives of this particular core codependency trait be negative or hurtful to us? Again, would it register in that basic diagnostic number 2, which is first the pervasiveness, second, how it impacts us? Probably not. I've seen personally that when anyone, especially codependent, is mirrored back from a person they're freely giving to, they don't see this as much of a problem, and usually there won't be a problem. Their lives, their feelings aren't negatively impacted, and often this exchange will actually add positive components to one's life. So if personality disorders, emotional issues, mental illnesses, etc., are based on that set of diagnostic principles, where one of the core most important elements is if the trait symptom are negatively impacting a person's life and relationship with others, then it wouldn't be covered. It wouldn't be part of that diagnostics. Along the same idea, there is this argument. If one person gives freely to another, and that person is selfish and doesn't give back, it's a matter of moral perception and philosophy as to who is wrong. We both have the right to internalize it however we want and feel, but that's based on your own perception and moral, because we're not talking about you. We're talking about the clinician. This is all about other people labeling you codependent, other clinicians, therapists, doctors, coaches, coming up with that label and slapping it on you, the media, so on. So that perspective is based on a moral idea of who is wrong. Who's wrong? The person that's giving too much, or the person who's selfish, not giving back, and exploiting the giving. So in our society, we're based on a self-serving individualistic society. It's that simple. So we tend to go to the person who is giving too much as being the one who needs to stop and set boundaries. Okay. But I, personally, my moral perspective is the person who's selfish is the one who's wrong. Do you see how this gets contorted into a philosophical argument? Look, I understand that looking within ourselves for our own happiness is a responsibility we all must accept. It's based from the Judeo-Christian theology and ideology that we must look inward to ourselves in our own relationship with ourselves, and therefore, i.e., relationship with God. I'm talking about historically, for our own happiness and stability in our life, and not look externally to other people. I agree with that. And I fully agree that this is important. But as such, we must acknowledge biology and that we are social creatures and we evolved this way, and that we must have balance between our selfish needs and with those around us. Yes, if you're going too far one way or the other, it's bad, but this is the thing. I have seen over and over the vast majority of people who are labeled as codependent aren't on that very, very, very extreme, giving so much. It's almost like giving it all. Having any core altruistic values is seen as disordered, as codependent these days. This is definitely a reflection of our society. And I wonder 20 years from now, 30, 50, 100 years from now, when this ideology changes, it's bound to change again. It's going to have to. Our world is falling apart. Marriages are falling apart. Families are falling apart. People can't find people to mate with, to marry. I mean, we're living in a very, self-serving, individualistic society, and it's going to change. And I wonder if they're going to look back at codependency, at another time in the future and just shake their head and realize that this wasn't a real issue, that this was a reflection of the greater social mentality. Okay, so let's say, I'm going to talk about something else now. If someone was with a narcissist for any length of time, does that mean there was something wrong with them? Yes, almost always there were red flags. Things that were covert, that we couldn't possibly see or know because we aren't psychic, right? They lied to us. Some of us had bad childhoods, or maybe naive. Some of our bad childhoods or issues we went through created some issues that allowed us to not leave or to stay in unhealthy or hurtful situations or relationships. Maybe some of us were afraid to be alone. Maybe we all are dreamers of love and hopeless romantics, yearning for the love they showed us at the beginning, idealization phase. For many of us, our narcissist or sociopath or toxic, manipulative, toxic partners, their tactics worked so well and brainwashed us so well that we didn't even see it. And we stayed. And is that because there was something inherently wrong or unhealthy or dysfunctional in us? Everyone has issues. It's the human condition. We all have things to work on. The goal should be to live in a fundamentally positive energy level state and in an overall happy state. But the goal should not to be without issues. That's impossible, and that's not the way we grow. That's not possible. Right? Again, the goal should be to be in a relatively healthy, positive level energy state. But the goal should never to be without issues. Because it's not possible. But there's a reason why so many people accept the little red flag issues that the narcissist created in the relationship. That in retrospect we look back and point to, that so many therapists will point to us and say, see, there's something wrong in you. See, you're a codependent. And that's often just not the truth. Again, I just ran through. We're not psychic. The person lied. It may be our dreams and hopes. Yeah, there may be quote-unquote issues. We may be too naive. That's an issue. But is it a hurtful issue in the greater scheme of things? That's a philosophical ideology. That's a philosophical debate. And it's because we see it as though if we were overlook some things, will always be because we have issues, bad behavior, selfishness. We are entitled. We see entitlement as normal. This is now becoming our society to see entitlement as normal. And again, the individual as king. All right. So, all right, here's another point of contention. I'm going to reiterate a few things. First, that the term codependency is so generic and has such a wide-reaching list of attributes that it can be contributed to nearly any non-personality disordered person, and even to a lot of personality disordered people at certain times in certain phases of their life, as I said before about narcissists. We as humans are social creatures, like I was stating before. We from birth need other people to survive. The characteristic and attributes that support our ability to ensure the love, support, appreciation, resources, giving to others, etc., that we need to survive, that giving of others, in essence, evolutionarily, it is normal in both our survival and our psychological sense to need other people, to give to other people, to support other people. We all overgive or rely too much on others in different areas at different times in our life, for different agendas in our lives. To deem this characteristic pathology as pathology undermines the very core altruistic qualities that give us our fundamental humanity within us. The core attributes of codependency are vital in the upbringing of our children. Without these core, quote unquote, codependent values, we would not be able to be mothers. We would not be able to raise children. We would not have roads. We would not be worried about the safety of others, food, health, environment, so on. Okay, so in this sense, the core of what codependency is really, again, is a philosophical issue and not necessarily a psychological one. So what do I mean by that? Well, because these attributes are attached of codependency are positive attributes that are vital for the continuation of the human race and society as we know it. The degree to how far we choose to implement these in one's life is a matter of philosophy. You can't not have them. You can't be without them. You just can't. You can go, actually, on the flip side, if you look at narcissistic personality disorder, when you really break it down from an ideological, philosophical standpoint. Okay, now I'm going a little bit out there philosophically, but you don't need any narcissistic traits. As much as, yes, they're healthy to have some feelings of selfishness and so on, but you don't need them for society to operate. Because why? Well, it would be a constant giving, taking cycle then. So if I were to put it in this very grandiose, philosophical kind of ideal, I want you to think about that. Think about two different worlds, human beings. One where it's all giving and no self-serving ideals or behaviors. And one is all self-serving behaviors and ideals and no giving. Think about that. Which society could possibly, with how humans are biologically and emotionally, which one of those could survive? I'll tell you right now that the one that has the quote-unquote codependent traits would survive. I'm not saying it would be perfect or it would be a utopia by any means. That's not what I'm saying. But what I'm saying is that it could survive because everyone would be giving. So you would constantly be getting your needs met by other people. You wouldn't have to look within yourself to meet your own needs. On the flip side, if it was all self-centered and self-focused, it couldn't possibly continue. We wouldn't even be able to rear children. If you weren't driving on a bridge, you wouldn't give a fuck if that bridge was safe or not, and people would die. You see what I mean? Okay. So that construct of codependency, as it is viewed in a modern society and as a quote unquote problem, was born from Alcoholic Anonymous. A lot of you probably know this about codependency. To describe spouses and people close to an alcoholic that were a central part of the overarching pathology of the alcoholic that went beyond drinking alcohol. It served to illustrate that it was a larger issue within a family dynamic and dysfunction, etc. So codependency was used as the term to describe those close to, for example, the spouse, the alcoholic, those people that allow the alcoholic to drink and function and who enabled them, etc. Well, because AA was originally primarily focused for men, male alcoholics in the 1950s and 1960s, when I've researched the beginning philosophy of that program, and not today's, but the beginning, the core, what it was built on, there seemed to be a strong need to shoulder the blame of the disease of alcoholism onto the woman in their man's life, their husband's life, whatever. At that point in time, in the beginning of AA, essentially to take away blame from the alcoholic, i.e. the man, and redistribute the blame to the codependent, who was essentially allowing the alcoholic to be an alcoholic, i.e. the wife or the woman. Now, I am by no means a radical feminist, so bear with me here. The argument I'm going to make first is about the birthplace of AA and women and codependency. And it's going to be the exact opposite about what modern times, whereby I believe codependency, like feminism itself, has gone way too far the wrong way, the opposite way. But looking at the 1950s, 1960s, this early inception of codependency created a huge loophole in the ownership of responsibility on the part of the alcoholic by creating a new disease or disorder in order to essentially blame the spouse / the woman. Excuse me. And while, yes, I absolutely agree that in some cases when it comes to addicts and alcoholics, the people closest to them, or the addicts closest to the addict's life, have a huge role in the larger disorder dynamic and dysfunction of that alcoholic or addict. How can we, in generalization, or generalize in a general sense, put the responsibility to anyone other than the person who uses the drug, though? Or was it a way to allow the addict to shoulder only part of the blame? All right. Because if you look at the gender roles and family dynamics of the 1950s and 1960s, again, this is where codependency was born from. Did a woman have much choice other than to quote unquote enable her husband's choices, including the choice to drink or use drugs? It was a part of the norm of that social construct in that era, the expectations of a woman, of a wife, to back up her husband's choices and keep their private life private. For example, the big example always given in codependency alcoholism is calling in for work for their alcoholic husband. That by virtue of doing so, it was enabling his behavior, allowing his life to continue to function in a normal sense, and therefore she was a leading part of the alcoholic's disorders, right? Because she was calling in for work for him and giving him the way out. But I have a question, and that social norm, looking at it from that social norm in the 1950s, 1960s, maybe a woman wasn't necessarily being codependent, but she had no other choice. She had to safeguard her family from having her husband out of work, having no food for her kids. Maybe she didn't have the option to leave and go to work. You know what? Probably she would have been, which was the norm then, she couldn't divorce her husband because there was too much social implications for that. Okay, so was this modern idea of codependency born out of a way for addicts / alcoholics to deflect the blame for their own poor choices, or a way for men to point the finger at the women in their lives for the alcoholism and drug problems? Was it? I don't know. The more research I do, the more I believe that's true. And now fast forward to today. The idea of codependency has become a feminist mantra, and in some ways it's been used as a way to justify abandoning female traditional gender norms. Being giving, selfless, altruistic, etc., are all traditionally maternal, and it has been looked at as feminine characteristics. This is at least the social norms. I'm not condoning them or not condoning them, I'm just stating kind of what it's been. And by creating a disorder that upholds these traits to not be good per se, it further has promoted women to abandon them, right? It just has. This is the movement our society has gone in for this period or era of time. Now, I know what a lot of people say, that it's about how far one goes with these traits that determines codependency. Yes, being totally self-sacrificing isn't emotionally healthy. The example in an airplane, right? When you go on an airplane and the flight attendants first tell you, here's the emergency exits, so on and so forth. They always talk about those masks, the oxygen masks, and they tell people, parents, make sure you put on yours first and then put on your children's, because the innate thing is to be totally self-sacrificing and to worry about your children first. But if you don't have oxygen and you pass out, you're no good anyway. Your children are screwed. So in order to, it's like starting at the end and flipping it around. To be truly self-sacrificing and to truly care about someone else, you have to first worry about yourself first. So that is very true. But in modern codependency discussions, I don't see a very extreme example of how far people are self-sacrificing or talking about others in order to be labeled codependent. That people are basically, I don't see that the spectrum has to be that far, that far one way or the other in order for somebody to be labeled codependent. It's like just small, self-sacrificing, altruistic traits or examples, traits or personality traits are looked at as being codependent. What I consider to be completely normal and healthy behavior and ways of thinking about being giving, nice, selfless, caring to others is now being labeled as codependent. I see it over and over. I went to Coda. I bought into codependency for many years, and it was by virtue. It's not like I just made made all of my viewpoints up out of thin air. I consider myself to be mildly codependent, whatever that means. I went to Coda meetings. In school, we didn't talk about it that much, honestly. Again, it's not in the DSM, but I've read about it tons for myself, for for clients, so on and so forth. So I really believe that 70 to 80% of people being labeled as codependent, actually their giving and so on is falling within a normal range. Now, it's not to say that there's not deeper implications. Again, it a lot of it matters where it's stemming from, like childhood issues, but I don't consider that to be disordered either. So yes, there are unhealthy sets of behaviors that some people learned growing up by basing their self-worth on whether mom or dad or others were happy, or serving others' needs over their own in unhealthy ways, and all of the other core codependent traits. But you cannot label them as widely as this and expect there to be more focus on healing than in those extreme cases of people. You just can't. Not everyone who is narcissistic has narcissistic personality disorder. Just the same, not everybody who displays some minor codependency traits and give too much sometimes and don't get back in return are codependent. But it seems these days everyone who at all really cares outside of themselves or puts others first are being labeled as codependent. In not very extreme ways, they're doing it and they're being labeled as codependent. And maybe this is simply a microcosm of the macro of our society. Encouraging people to be selfish, encouraging people to be independent. It's the I, me, my, society we have. Our children should come second to our own wants and needs, to our dating, to having successful careers. Crazy. There's a CODA, 12-step program for codependence, but there's no narcissistic anonymous. Why? That's much more damaging to our society. I think there does need to be therapy recovery focus modalities for those people that have extreme self-sacrificing traits, extreme, and other traits lumped generally in the codependency camp. But it needs to be broken down, like I said before, into several other disorders and specific or specified to, number one, allow for therapy recovery to focus only on the traits that are unhealthy and harmful and leave the other non-extreme altruistic giving traits alone because they are positive and we need more of that in our society. And number two, to discourage this mass blanketed codependency labeling on so many people that don't really have real issues and shouldn't be labeled as such. And number three, then to prevent the codependency recovery to then be producing more self-focused, selfish individuals, because that's what's happening right now. It is. A lot of codependents I've known quote unquote codependents labeled. They went through recovery and healing, and I'm going to tell you right now, many of them are incredibly selfish now. There's something wrong in a lot of therapy modalities if this is happening. We need to encourage in our society. Again, it's a foundation of being human, of surviving. This is, of keeping a good environment, of building a bridge, even if you're never going to drive on it, that is safe for other people, of being parents that care about their children. We have to be altruistic and giving. This is a core human. It gives us our humanity, and it is what has allowed our society to flourish and the human race to flourish and continue. We need to encourage these giving, nurturing, altruistic traits in people. We need to get rid of the I, me, my of our current society and this individualism that reigns and trumps all else found. And to truly be happy and to develop sustainable social structure, we must be interdependent. But interdependency, it's like codependency is like the extreme of one end of that. But then they're lumping all of these traits that you need for so it just blows my mind, right? Okay, in order to be interdependent, you have to have very strong giving, altruistic traits. And yet in codependency, they're saying these traits are bad. And the spectrum is very, very wide, right, to be labeled codependent. And then they're saying get rid of these. We need to build, only the self matters, only you matters, yada, yada, right? That's true in the context of like the airplane oxygen mask context, but in most other contexts of our daily life, that's not true. It's just not. By getting rid of those traits, it's actually doing more harm than good even to that person. So it should be broken down into more specific therapy, healing, issue specific, like attachment issues, self-esteem, and for many, they don't even really have these so-called codependency issues as much as they need to heal from, let's say, trauma from a narcissistic relationship or narcissistic abuse or a narcissistic parent or childhood trauma or neglect. This is what needs to be focused on. And there should be no label of codependency when you're focusing on that. And the reality is, I'd say for 50 to 80% of people, I don't know, labeled, probably 80% of what I've seen, labeled as codependent, they aren't really codependent. Not on the spectrum and not on the effect. And when it comes to things that, like narcissistic abuse, so-called enabling an addict, things are complicated. And it does not mean automatically that someone is codependent. It just doesn't. All right. Lastly, the current modern society that we live in is focused, like I said before, on individualism instead on the collective. All of our pop culture, all of our media, if you really look at what's going on here, and many things taught in schools, that we teach people to be focused on I focus on the self first, and being self-focused. And it's done at the expense of the greater good. Even when the greater good even when the greater mass of people will be negatively affected or impacted. The mentality of our mass norm in our society is based from this self-focused ideology. Okay, in the media, we have reality TV. Everything's about me. Kids are taught that they are great and they all win trophies, even if they suck. It's not about healthy competition. Even though competition in many ways may seem to be individually based, I win equals you lose mentality. Many studies have shown that healthy competition actually creates more of a community-based viewpoint. Having healthy competition creates more altruism. It creates more teamwork, more, you actually bond externally to your competitors. Whereas now we see the family unit totally broken apart, not close. The norm being divorces, again, individual needs, number one, and this breaking apart, kind of everybody going in their houses, and children going in their houses, sitting on their computer, children leaving far, far from home at 18 years old, where friendships seem to exist more on Facebook and online than in real life, where cheating is now normalized, thus creating more division in committed relationships, where YouTube and online social media gives us a community, how we all sit by ourselves, focused on ourselves, at a home, with the doors closed, by ourselves again, focusing on ourselves in front of the computer, and we have convinced ourselves, because we know we all have a core need, it's an absolute need to be around other people, to be good to other people, to have a community. So we've created a community online that isn't real, even porn. Look, I've met many guys who become so addicted to porn, the brain chemistry gets all whacked out. I'll talk about that some other time. I've been really studying this a lot, where men can't even have sex with women anymore. So I ask you, and they're only watching porn. So I ask you, why is there, again, I talked about this before, a coda, but there's no narcissistic personality disorder anonymous? Because I philosophically believe that the traits of the narcissist are revered much greater than that of the codependent, quote unquote. And you have to wonder, with so many recovering codependents, is the very nature of the empathic personality type to be the one to take the blame, to set up in any situation, I'm the one with the problem. Okay, I'll go get help. See, people with codependent traits tend to automatically, inherently have strong empathy and strong self-blaming. They're willing and able and often do it too much. Again, we talked about that before. And these people, the empaths as a whole, this personality type, are more likely to take the blame themselves, be more likely to take on the labels such as, quote, I'm the one with the problem, or, quote, I'm the codependent, I'm the one causing the problem. And then go to get treatment, 12-step programs for their codependency issues, and possibly take away the responsibility from the disordered/dysfunctional person in the dynamic. If you've ever been with a narcissist, someone with narcissistic personality disorder, you probably have seen how they will put it onto you, and see people with strong codependency traits tend to be the one that will say, okay, it's me, I'll fix it, just wanting things to be good and caring about that person, and holding that relationship sacred because they want it to work. But again, there's a lot of brainwashing, lying, and so on and so forth. See, in Coda, when I went, many people, as I got to know them, didn't really have codependency, quote unquote. As in, they didn't even have it based on this generalized, the modern concept of codependency. They didn't even have it. Not that they didn't have some certain traits or issues, but that in reality, their issues were either not cohesive enough to entirely label the person as codependent, and whose issues should have been broken down into smaller bits based on like trauma or specific thing in their childhood, attachment issue, and most importantly, that the codependency was only directly related to one specific area of their life. Situational codependency, one specific area, person, or time in their life, which says to me it's more of a targeted problem in someone's overarching life structure and logistical life, who they're spending their time with, etc., what they're doing, and that needs to be addressed. So, for example, they're in a relationship with a narcissist, they're having narcissistic abuse. They're not codependent because they're acting a certain way. When you look at all of their areas of their life, they weren't acting with these strong, quote unquote, codependent traits, only with that one person, because that person was narcissistically abusing them. And then that codependency was actually more or less PTSD and other self-esteem issues that were actually being played out. They weren't what quote this quote unquote codependency issue. So, that's doing a huge disservice as well. You go to a clinician, a therapist, a coach, a doctor, and you say, you tell them what's going on. They're not even looking at it situationally. They just labeled this codependent label on you. There you go. Bam, you're done. It's easy for them. And then nothing changes. And then the thing that's making you quote unquote codependent, because you're not that way, and you don't show any extreme traits of codependency traits in other parts of your life. It's crazy. So if you think or have thought you are a codependent, or you have taken on the codependency label, I challenge you to see codependency slightly different. Also, I want you to encourage you that people who are good and who are caring about others and altruistic, they should be revered. You should see these traits in yourself as something that's positive and good, and more specifically focus on, again, like I talked about before, is this just one part of your life? What is this situational? Based on one experience, is this childhood issues being played out? And exactly what are they? Self-esteem, attachment. I want you to it's okay if you want to keep on the codependency label. By all means. If you feel safe in that label, you should do it. But I want you to break it down into smaller parts so you can actually heal, instead of just be labeled as codependent and then becomes, very self-focused. Because that will create more problems, and that's what I've seen. All right, so I think that covers the majority. I'm going to do a part 2. I still have quite a few other things to discuss about codependency, which is crazy, right? So I do, I'm not saying codependency is not real. I'm not saying that the issues of relying on someone that you're having a relationship with, or other people too much, or giving too much, or self-sacrificing too much, that these can't be dysfunctional or unhealthy. What I'm saying, though, is that this label is too generic, too broad, that I would guess anywhere from 50 to 80% of people aren't extreme enough on the spectrum to actually be labeled codependent, yet they are. There's a whole bunch of different reasons why. Some of them are social, because of modern society. Some of them are because therapists, doctors, coaches, clinicians, it's easy for them to label you codependent instead of really getting to the core of it. And again, because empathic personalities are more likely to have these codependent traits, that's inherent to take the blame. So it only makes sense to put the blame on that person who will take it. Because guess what? With the selfish, personality disordered people, they ain't gonna ever change. So it's kind of like, well, we'll do what we can do, but that's not right for you. Just because someone else won't change doesn't mean that you should, even if you're not wrong or bad, or you're not doing anything that causes greater harm to yourself or others. So, all right, this is the end of part 1. I know it's very long. I hope you stuck it out there with me, and I will be doing part 2 in the next 3 or 4 weeks. Thanks, everyone. Namaste.